Washington.
Well, for some, the pandemic has really impacted their mental health, and professionals want you to know how easy help is to find. And joining us now with more is Patricia Rehmer, president of the Behavioral Health Network and senior vice president at Hartford Healthcare. Thank you for being with us again, Patricia.
Sure.
So early on in the pandemic, you established a number to offer free community support for those struggling. How many calls have you received, and what types of calls?
Since the inception of that hotline, we've received over 600 calls, and the calls vary. They can be people that are calling perhaps just to seek a little bit of reassurance, might be experiencing some anxiety because of something, for example, they heard or saw or read, to people that actually do need services and need to be seen and evaluated and perhaps need treatment. So out of the over 600 calls, we've gotten about 60 referrals into our programs and into our outpatient clinics. And we are open for business and want to be sure that people are reaching out when they need help.
That's certainly great to hear that people are getting help. And it's been a difficult time for all of us. But what about those with pre-existing mental health issues? How are they coping?
Well, I think it's very individual, but for example, people who have something like OCD, obsessive compulsive disorder, that might already be struggling with anxiety around things like their hand washing and those sorts of things to keep themselves clean. Some of those people are probably experiencing more symptoms and needing, for example, to come back into treatment if they were out of treatment. And certainly people who have pre-existing anxiety disorders are struggling as well. This is just a time where people are terribly anxious.
All right, we've seen alcohol use on the rise. Numbers have increased sharply in the last few months. Are you surprised by this?
No, we're not. We predicted that we would have increased need for mental health services and substance use services, disorder services. People were isolated. People who even were in long-term recovery may have struggled. And so it's very important that those people are connected back to their communities or to treatment if that's what they need.
All right, let's talk now about PTSD. It's been a real issue in these times, with many people losing loved ones, jobs, juggling homeschooling. You name it, it's all being thrown at us this spring. How do you help someone deal with the after effects of this crisis?
Well, that's going to be the critical question, right? Because we already know that the World Health Organization is predicting 75,000 more suicides in the coming year. And so we really do have to get in front of PTSD, which is being experienced certainly by healthcare workers and employees of hospitals that have been facing these deaths daily in large numbers, but also people that, for example, lost someone and wasn't able to have a funeral. So we're going to see interrupted grief, which will create issues for people as well. So we really have to pay attention at this point to people's mental health and substance use issues, because otherwise things could get really out of control.
So many levels, you're right. All right, your community care center hotline, tell us what that is. Where can people call for help?
So that is the hotline that we established in mid-June, I believe. That is the one that has the over 600 calls. We have clinical staff 24/7 manning that number, and it's been, again, very successful to date.
All right, let's give that number, 1-833-621-0600. Patricia Rehmer, thank you for joining us once again, and keep up the good work and the help you're providing.